Well, we're talking here with Dr. Nguyen, dentist in Round Rocks, Texas. Hi, Dr. Nguyen. How are you?
Hi, Mr. Flash. I'm good. How's it going with you?
Windy. Let me ask you, Dr. Nguyen. You're a general dentist. And let me ask about your practice.
Yes.
You see, as patients, we kind of like are sometimes a little confused. On one hand, we believe that a dentist is a dentist is a dentist, and you have a license by the government and all that stuff. And on the other hand, we also know that there's a lots of personality involved in a different dental office, and we're looking for a dentist which fits our personality. Now, what can patients expect in your practice? What is your practice like? Is it a practice which does only the Julia Roberts, Tom Cruise type of smile, very high aesthetic? Is it a practice which does functional dentistry where I can actually come in with a filling and get it fixed and walk in? Can I bring my kids there? Can I do orthodontic? If I need an implant, can I get an implant? And if I do want a beautiful smile, like a total makeover, so to say, can I get it with you? Would you, basically, are you a all under one roof dentist? What explain that to us? And by the way, Dr. Nguyen, if you don't mind, tell us what made you becoming a dentist?
Yeah. Well, let's start with that first. Pretty brief. I came here, from Vietnam when I was 20 years old, and I started working at a dental office in Southern California as a dental assistant, and I kind of fall into it in a sense. So I decided to go to dental school and to become a dentist, just like my boss. So here I am, 20 years later, I guess. I'm sitting on the other side of the chair, like you say.
Now you're a dentist?
Now I'm a dentist.
So you're basically growing, very naturally. You actually, which very few young people do. They choose a profession for whatever reason, be it money, be it this, be it that. I mean, there's many factors. But you worked in a dental office as an assistant or something like that, I assume, and
yes.
I may be wrong, and you said, I like that, and then you went to dental school, got it all knocked out, and became a dentist. That's great.
Yeah, that's pretty much it. Yeah.
That's wonderful. So, what about your practice? What can we expect in your practice?
Our practice is a general practice, general dentistry. Basically, it covers pretty much all the things that need to do with teeth. From extractions, you can go on to getting crowns, fillings, pretty much everything. Root canals, like gum treatment, and we do see kids. So basically, it's a family dentistry, a family dentist. So we see kids. Some kids are even like a year or 2 years old in our practice. And we are pretty laid back. We very.
Texas. You're in Texas. I mean, what else do we expect from a what else do we expect from a Vietnamese Texan lady? We treat everybody like our own family members, like an extended family in a sense. So. And we've been getting a lot of compliments about that. So that is one thing that keeps us going. Beautiful. So you said you're seeing children. Are you also putting braces on those teenagers once they get into that age?
Yes, we do. It's pretty rewarding, like you see, you can bring up the confidence in some of those kids. They come in with crooked teeth, they can't really smile, and they got teased from their friends and their, like peers, and a lot of negative things going on about that. And then you can kind of help them out. So that, in a sense, is really nice.
Good, beautiful. So you really are a truly all-around family, doctor, family dental office. Now, so on the other hand, if somebody comes in and wants that smile makeover and do a bunch of veneers and get an implant here or there and whatever it may be, he will be taken care of also?
Yes, we do all of that too. It's pretty much as like we a patient wanted, like we're driven by what the consumer wanted, and then we would step up and try to get, provide what the patient would need in a sense.
So basically, the consumer wants a certain thing, but since you're a doctor and not a sandwich shop, so if he wants something which clinically is not good, or if he doesn't ask for something which he didn't know he needs because he didn't get the examination from you, then of course you would match that up. His needs and his wants.
Yes. Yes. Thank you for bringing that up. And I want to clarify that a little bit. And obviously, as a clinician, you have more training and you have experience and you've seen things that work and seen things that will go bad or will become a major issue if you don't take care of them right now. And that is where, we come in and explain that to the patient. Certain things that you may want, but it may not be fitting for you. A certain thing that you need, you may not see it right now. You don't think that you want it, but these are the things that need to be taken care of. So we do, that's a big part of our practice also, like patient education and explaining the procedure. And I do spend, quite a bit of time on that with the patients.
Well, I've noticed that a field like dentistry, medicine, those type of fields, is a little bit like being a mom. On one hand, of course, you want to fulfill the wish of the child. At the same token, you got to gently insist that they do what has to be done.
Exactly. You very good analogy. I cannot express it any better than that. I mean, it's exactly true. And sometimes it requires a lot of patience from us, in terms that you just have to repeat the messages over and over until the patient get it through and see it, from your viewpoint too.
Right. It's quite hard for most of us in most areas, but different people in different areas, to kind of act on a problem which isn't occurred yet, which doesn't, so to say, hurt, but will have negative effects a few years down the road. We seem to be all, including the government and stuff, trying to kick the can down the road in our own area. It's easy to see another person is kicking the can down the road, but we, in our own areas, whatever that is, we all do it also. And that causes us more suffering than there should be. Well, it was nice talking to you about this. I think you explained your practice well, and congratulations on becoming a dental assistant, looking at it and saying, I like this, and then actually coming out at the top of it and being a doctor. Wonderful. Wonderful story. Thank you.
Thank you for taking the time and talking to us.
Sure.